Hey everyone, welcome back. It's Dr. Scott from Enhanced Wellness. Before we get to today's video, I would like to remind you that if you're watching our videos on Facebook, please make sure that you like and or follow us. That'd be awesome. Give us some feedback so that we can make sure that we're delivering for you the content that you desire. Secondly, if you're watching videos on YouTube, subscribe to the YouTube channel and you can make sure that you get the videos as soon as they're loaded up. So, last time we got together, we were talking about hip, pelvis, and lower spine, how that's integrated together as a functional unit, and how we see a lot of problems in our patients and clients relative to that region and imbalances that develop. One of the most common imbalance patterns that we see is tension in the flexor muscles of the hip. So the flexor muscles of the hip are the muscles that are going to raise the knee toward the chest. One of the reasons that we develop imbalance there, one of the primary reasons, is that we sit far too much. In a sitting position, our hip joint is kept at a flexed or a 90-degree angle for prolonged periods of time, and if you multiply the effect of that over time, you get a situation where you develop an imbalance between the flexor muscles on the front of the spine, hip and pelvis, and the extensor muscles on the back side of the spine, hip and pelvis. And that creates an essential and very common imbalance. Now, how do we start to get that balance back? One of the best things to do is start to mobilize the stiffness in the hip joint with what we call a hip flexor mobilization pattern. So the hip flexor mobilizer looks like this. You take the affected side, place it down, and then go into a modified or a kneeling lunge pattern. The back foot should be relaxed, the forward foot placed in a comfortable position, square up your pelvis, and lean forward. When you feel some tension in the downside hip, you've reached that barrier of stiffness. Go into that and then come off. Go back into that again and come off. This utilizes what we call in our practice an on-off mobilizing pattern. We go on to the stretch, we come off. We go on again and we come off. Go progressively deeper as you can into that range of motion, opening up this area. That's the goal for this particular mobilization. A modification of that, once you start to get good at it, is you can start to go around the clock. So in this particular variation, you come into your flexor stretch, and then you go to the next clock position with your forward foot. Now you're not only opening up the hip flexors, but you're also getting the hip flexors and the adductors or inner thigh muscles, and you can go around the clock as far as your mobility will take you. Now, if you're doing these mobilizing movements right, you shouldn't feel any sharp pain, you shouldn't feel any increase in pain, just a stretching or a pulling sensation that should be mild to moderate. If you want to add some intensity, you can always go to this next step where you lean forward into the stretch and then reach up toward the ceiling and then add a slight side bend away. So play with this a little bit, start to mobilize those hip flexor tension patterns. It will really free up your lower spine, pelvis, and hip unit. Remember, that is the basis of all functional movement and all athletic movement, so it's important to get that right. I look forward to seeing you next time where we're going to start to look at ways to open up the rotator muscles of the hip. That'll be a good session. You won't want to miss it. Until then, take care. We'll see you next time.